Ayurveda is said to be an eternal science that first existed in the universal consciousness before it was passed from the Creator to the ancient Indian mystics through meditation. Ayurvedic medicine is one of the world's oldest holistic healing systems, which was developed about 5,000 years ago in India. We open the first chapter of Ayurveda Diaries with prominent Ayurveda exponent Dimple Jangda, who delves, discusses and diagnoses the causes and prevention of many disorders and diseases in her Back to Nature series.
Welcome to the Ayurveda Diaries, where we rediscover our roots back to the nature. And we have the expert who helps us know what is right for us. And today we are going to talk about something very interesting and very important: infertility, PCOS, PCOD, which are common ailments and have to be noticed and worn and taken care of. Today we have Dimple Jangda, who is the founder of Prana Healthcare Center and Prana Academy of Ayurvedic Life Sciences, which was awarded as India's best healthcare center. She has trained many other Hollywood and Bollywood celebrities. She has also taught and treated patients and students from more than 49 countries. Welcome, Dimple.
Thank you, Sudakshana.
Well, being treated and have been in contact with so many people who are from diverse places, diverse culture, there must be the common ailment which has been discussed again and again.
Of course, infertility, PCOS, PCOD, which you mentioned, has been plaguing the lives of millions of women around the world. Nowadays, 4 out of 7 women complain of infertility, PCOS, PCOD, or menstrual disorders. Men also complain of infertility, and this is a cause of concern. Lots of people say that it's nature's way of controlling population in the world, and thus it's causing infertility so that we can control the resources in the planet. But of course, that's the other understanding of it. But if you can live a healthy life, why not? And that's only possible when you align back to Mother Nature.
Well, I also read the stats that 1 out of 6 couples face infertility. Why is this happening, and why is this a growing concern?
One of the main reasons for it is our fast-paced city lifestyle. There's a lot of stress, a lot of anxiety, irregular eating habits. Our metabolic fire is haywire. That definitely affects the moon cycle in women. It starts causing delays in their menstruational cycle, or excessive bleeding, or less bleeding, or PCOS, PCOD, other kinds of gynecological disorders. Cysts and fibroids are also becoming very common nowadays amongst young women. In fact, I have faced some of these problems too as a young teenager, and now I'm happy to say that I'm free of all of these health issues.
And is this because of Ayurveda?
Definitely. I have actually undergone 4 surgeries even before I turned 20 for multiple reasons, not stating them at the moment. But ever since I discovered Ayurveda, I was able to avoid my 5th surgery. I was able to help my father avoid a surgery. I've seen a lot of patients dissolve kidney stones, gallbladder stones, conceive naturally without any kind of artificial treatments. I've seen patients come out of clinical depression, and multiple sclerosis patients walk again for the first time. Paralysis patients speak again for the first time. I've seen miracles happen every single day at the clinic, and I can tell you, this is here to stay.
Well, I believe it's a privilege to be doing a great job to the world, for the world. But again, infertility and Ayurveda, how does Ayurveda address infertility?
One of the main causes for it is irregular metabolic fire and bad diet. Now, if you look at PCOS, polycystic ovarian syndrome, it's actually a metabolic disorder. PCOD, polycystic ovarian disorder, is an ovarian disorder, and these two are difficult to treat because it requires a dramatic shift in your diet, your lifestyle, and your eating habits. Infertility, difficulty in conceiving, could be due to several reasons. Of course, these disorders being some of the main reasons for it. In our modern lifestyle, what we're experiencing right now is a continuous state of low intensity stimulus or low intensity cortisol levels. Like even if the phone buzzes, we're in distress. There's a message that is unread, there is an email that is unread. We're going through constant state of stress and anxiety. And that is definitely going to affect your hormones, your moods, your gynecological health, your moon cycle and everything for a woman, right? And the same goes to a man. The main causes for infertility in men is usually stress, anxiety, excessive work pressures, irregular sleeping patterns, not following the circadian rhythm, and irregular eating habits, sometimes skipping meals, sometimes eating a large meal, eating a lot of packaged foods. All of this leads to infertility in men. Now, there are a whole series of medicines that can be prescribed for men. In Ayurveda, we have medicines like Ashokarishtam, Ashwagandha. Then we also have medicines like Shatavari, Gugul. All of these herbs helps in building strength, vigor, vitality in men, and also helps in boosting their metabolism.
What else one can do at home, starting from their own kitchen and their own plates? What are the lifestyle changes they can do in their lives?
Starting with women, because women are the ones who suffer the most from infertility, PCOS, PCOD and such disorders, you will have to do a dramatic shift in your diet, starting with giving up dairy products. Even though I do recommend dairy products for the ectomorph or the Vata Prakriti body type, but if you're suffering gynecological disorders, it is because your body is unable to digest the hormones or the estrogen that it's producing, right? Now, indigestion of food leads to stomach-related diseases. Indigestion of thoughts leads to anxiety, stress, and depression. Indigestion of estrogen leads to gynecological disorders. It's basically a form of indigestion. When you're not able to digest your own estrogen, it's not advisable for you to consume the estrogen produced by another animal in the form of eggs, milk, yogurt, buttermilk, cottage cheese or yellow cheese, fermented cheese, or any other kind of dairy products, even sweets, right? You must stay away from dairy products, from meat, from seafood, from eggs for sure, because at the end of the day, you're just consuming estrogen and you don't need that at the moment. We're also the only animal in the food cycle that consumes the milk of another animal,
right,
which is a bit unnatural. Technically speaking, we need milk or mother's milk only up to the age of 3 or 5. After that, the body can absorb nutrition from plant-based food. But of course, you know, in the Indian culture and most cultures, milk is a huge part of the staple diet. So you can start consuming milk from a cruelty-free organic cow's farm, where the cows are raised on a farm, not in a factory, where the cows are not confined and going through trauma, where they end up releasing cortisol, pus and blood into the milk, and where the cows are not artificially inseminated and forced to give birth every year or injected with hormones, because that makes them release estrogen into the milk. So don't consume milk that comes in a Tetra Pak. That is unhealthy. Instead, consume milk that is organic. If you're in India, you must drink A2 cow's milk, because that's milk from the Gir cow, which is native and indigenous to the Indian topography.
Okay, getting back to the favorite part of the show, the rapid fire. And here I want you to suggest the best herb. Best herb for men.
Ashwagandha. It's called smell of the horse, and it basically helps in stimulating vitality, strength and vigor.
Okay, best herb for women.
Shatavari.
Best spice for fertility.
I would say fenugreek.
And best remedy for period cramps.
Carom seeds, also called ajwain.
Great. Because we have been talking about PCOS, PCOD, which is the root cause for infertility, why it has become so common and how can we treat it?
So, like I said, PCOS and PCOD, the first rule is to go on a plant-based diet, completely give up meat and dairy-based products. That is number one. Number two, there are a series of foods that you can include in your diet on a daily basis to help purify the blood and rectify the damages done to the uterus. Starting with foods like carrot, beetroot and spinach. You can make a soup out of it and drink it every single night for 28-day cycle and see the dramatic shift in your health. You must include spices like fenugreek, carom seeds in your food. You can include fenugreek while you're making your lentil soup or your dals. You can have carom seeds when you're making your vegetables or your bhaji. That's a great way of incorporating it in your daily life. You can have a lot of seeds in your diet like chia seeds, flax seeds, sunflower seeds, pumpkin seeds, or even sesame seeds. These are excellent sources of protein for women who are going on a plant-based diet. Then there is also fruits like pomegranate and black grapes. They basically help purify the blood, and the blood that's rushing to the uterus ends up carrying fresh oxygen and thus helps in repairing the damaged tissues, muscles and nerves. Now these are the few things that you can do. Seed cycling is of course becoming very popular in the West, but it's something that was part of the Indian culture for the longest period of time. Having seeds in the form of tilka laddu or in the form of sattuka laddu or in the form of desserts. We always had seeds.
Right.
And there are of course some more herbs and seeds like cumin seeds, fennel seeds, they're excellent. They help women prevent UTI or the urinary tract infection that they seem to be prone to. You can also have coriander seeds and like I said, carom seeds. They're excellent for helping prevent period cramps and other gynecological health issues.
So most women don't even realize that they have PCOS or PCOD. What are the signs one should look out for?
Well, it's true that a lot of women go undetected. They don't go get their diagnosis done or the test done, and they're unaware that they have PCOS, which is a polycystic ovarian syndrome. This is usually caused due to metabolic disorders. So that happens when you don't follow the circadian rhythm of the sun, when you're not sleeping on time, when you're not eating on time. This leads to a continuous state of hormonal imbalance, which then triggers PCOS or the polycystic ovarian syndrome. Now, the signs that you should look out for are, first of all, irregular periods. If you're not getting your periods within the 28-day moon cycle repeatedly, then that's something that you must definitely get checked up. You must go to a gynecologist and figure out what's going wrong. Second is hirsutism or excessive facial hair growth. That's a sign of PCOS. Sudden weight gain and difficulty in losing weight, infertility, having trouble in conceiving a child, and of course acne, repeated adult acne. It's very difficult to treat, it is unpleasant, but more than a vanity issue, it's a health issue. You must definitely go check with a gynecologist and figure out what's going on inside your body, then start the right medication and the right plant-based diet and all the superfoods that I mentioned.
Is PCOS a life-term condition? Can it be cured?
Definitely can be cured. It's not something that you have to live with for the rest of your life. We've had a lot of young women come to the clinic for PCOS and PCOD conditions, and they have been put on a very strict diet protocol, number one. And number two, we've also had them consume a lot of potent Ayurvedic herbal medications. For example, there is Saptasaram Kashayam or Sukumaram Kashayam that is particularly good for gynecological health. They have to consume it for a period of 3 to 6 months sometimes. And you must also marry it with good yoga exercises. In fact, there are a set of exercises that are excellent for strengthening the core muscles around the uterus and the pelvic floor. We have, of course, the camel pose, the Navasan pose or the boat pose. Then we have the butterfly exercise that stimulates blood circulation towards the core. You can also do Pilates that strengthens the core. Strengthening your pelvic muscles will also help women particularly battle this condition. Losing weight, of course, is mandatory for both PCOS and PCOD because that is going to help you battle this condition better and faster.
What about men? How do they deal with this?
Luckily for men, there are a series of herbs that are mentioned in the Ayurvedic text that they can definitely consume. There is ashwagandha, like I said, it's one of my favorite herbs for increasing vitality, strength and vigor. Ashwa means horse and gandha means smell. It means smell of the horse. So that's excellent for men above the age of 30 and 35. They can definitely consume this every day in the morning with a glass of milk or just plain water. There is also kavach, there is muesli, and there is, of course, Shilajit. These are some very potent herbs that men can start consuming to increase their strength and vitality.
You also mentioned some of the success stories at your clinic in your work time experience. Is there anything you want to share with us?
Oh yeah, in fact, at the clinic, we witnessed 3 women conceive naturally after undergoing the Panchakarma treatment. There was this client, I'm not going to mention her name, she had undergone multiple IVF, an Australian client, and she was struggling a lot with trying to conceive. She had undergone a 28-day Panchakarma treatment, which is a series of Virechanam, Abhyangam, Basti and Nasyam treatment. Virechanam basically means taking oral medication, oral medicated gridam, which helps in collecting the toxins from the body and lubricating your entire gastrointestinal tract and preparing the body for purging or detoxification. Then we have Abhyangam, which is a full body oil massage. It's also called Sneha Basti, Sneha meaning love, Basti meaning pooling of oil. So Sneha Basti basically means pooling of oil on your body with love, with care and affection. That helps in stimulating blood circulation all over and collecting toxins from all over the body, bring them towards the gut so we can flush it out. After this, we also have a treatment called Nasyam, which is a very powerful treatment for women suffering from gynecological health issues. Believe me, Introducing medicine through the nose can actually correct your hormonal issues. So it's a process where we do an oil massage of the sinus glands and help in releasing all the mucus and the trapped parasites there. And then we do a dry hot fermentation, which helps in releasing the mucus again. And then we introduce medicated Ayurvedic oils through the nose, 2 to 4, 6, 8 or 10 drops depending on the day of your treatment. This treatment is done for a period of 7 days or 14 days based on the doctor's advice. We use a series of Ayurvedic oils like say Anutailam, Balatailam, Shirabalatailam or Kumkumadi Tailam, or even medicated ghee through the nose. What it does is it stimulates the 20 nerve fibers that are here between the nose and the skull, which is directly connected to the pituitary gland. The pituitary gland is responsible for sending messages to all the organs, explaining to them how to function. And the pituitary gland is also responsible for hormonal balances. It tells your body how much hormones to release. Thus, you can actually correct imbalances and gynecological issues by introducing medicine through the nose and stimulating the pituitary gland. Then, of course, we have the Shirodhara treatment as well, where we drop medicated oil on the forehead in a rhythmic fashion, forcing the brain to go into a deep REM sleep so that the brain can get that holiday, that time off to correct all imbalances in the body and stimulate the pituitary gland and thus correct hormonal imbalances. The last, of course, is the most powerful and the most important treatment in Ayurveda, which is called Basti, that is pooling of oil through the uterus or the colon. Introducing medicine directly into the uterus is called Uttran Basti. Especially for women and men who are planning to conceive, remember that the fetus is going to stay in the womb for 9 months. That's going to be home for the child. You want to give your child a clean home, a healthy home. It's very important for you to cleanse the uterus right before you plan to conceive. That's why Panchakarma is recommended heavily to women who are planning to conceive and have a child. And even men should do a Panchakarma treatment because it helps in improving their fertility rate, their sperm count, and the chances of the couple conceiving a healthy baby. Now, the child's prakriti is determined based on the health of the sperm, health of the egg, health of the uterus, and the kind of diet that the mother follows during pregnancy. The two factors being health of the sperm and the egg can be corrected with Panchakarma treatment, and of course through an education process called Garbha Sanskara, which is prenatal care. We educate the woman on how to educate the fetus in the womb. That is an excellent and a powerful exercise. Now, for those of you who can't do Uttran Basti, which is introducing medicine through the uterus, through the vagina directly into the uterus, they can do Matra Basti and Kara Basti, which is basically introducing medicine directly into the colon. Because if you remember, the colon and the uterus are like the neighborhood aunties who love to exchange gossip and energy. So if you introduce medicine into the colon, the uterus will end up absorbing that medicine and will end up rectifying and repairing all damaged tissues, muscles and nerves. A Panchakarma is literally a boon from Mother Nature, from Ayurveda, for all the young couples out there who are struggling with infertility issues, gynecological disorders, and several other issues that can cause stress on their relationship, their marriage, or their family life.
What about period cycles? How do we know if we have regular period cycles or an abnormal period cycle?
There are actually few signs that you can start paying attention to tell whether you're having a regular period or an abnormal period. Now, if you look at the moon cycle of a woman, it's usually 28 days and it coincides with the cycle of the moon actually. That's why it's called the moon cycle. If the cycle lasts anywhere between 28 to 40 days, it's normal. But if the cycle is more than 40 days, if your periods are getting delayed frequently and takes more than 40 days for it to come, then it's abnormal. The second thing you pay attention to is the amount of bleeding. Between 20 to 80 ml of blood loss during periods is normal, but if you lose more than 80 ml or less than 20 ml, then that is irregular periods again. You also look out for signs of period cramps. If the cramps are mild and it doesn't affect your lifestyle, then it's perfectly normal. But if the cramps are extremely painful, it affects your lifestyle to the point that you have to take off from work or not go to school for 2 to 3 days, that's abnormal periods again. Number 4 is paying attention to the number of days you're bleeding. Anywhere between 2 to 7 days of bleeding is considered normal. Anything above 7 days is definitely abnormal because you're losing a lot of blood. You must definitely check with a gynecologist immediately or an Ayurvedic doctor. And the next is, of course, paying attention to the color of discharge and the blood. Bright red, red, or deep orange is perfectly normal, but anything like purple or yellowish or orangish color is definitely abnormal, so you must check with a gynecologist. These are the signs that sets apart a normal period and an abnormal period.
Okay, but what about working out? Is it recommended during periods? If yes, what kind of workout regime?
Honestly, the body is going through so much change. The uterus is one organ in the body where kapha, pitta and vata, all three doshas, all three biological building blocks can be found. For example, during period cycle, when the blood is leaving your body, that movement of blood out of the body is due to the presence of vata, which is movement, air and space. The uterus is also where we produce babies. We're creating new life. That's the presence of the kapha biological building block, which is made of earth and water, which is building new life. Then there is, of course, pitta as well, which is available in the uterus. The uterus is a unique organ that has all three biological building blocks. It has a natural self-cleansing process that it's going through during the period cycle. And it's the best time for you to sit back, relax and enjoy that hot cup of chocolate if you like, or any kind of comfort food you like. You might have cravings for salty foods, sour foods, or junk food, or a lot of sweet foods. Give in to those cravings to a certain extent, but not excessively. Eat some healthy food, well-cooked foods like moong dal khichdi maybe. Avoid having yogurt, which is fermented and has active bacterial enzymes during your periods. Do not have yogurt. You can have a little bit of dairy products or plant-based vegan milk if you like a glass of coconut milk or almond milk. But the period cycle is basically nature's way of saying, slow down, take it easy, rest and enjoy this time off. Watch a movie, cuddle up in your bed and eat a big tub of popcorn if you like. But please don't exercise. Don't exert yourself any further.
So what are the signs of PCOD?
PCOD is slightly different from PCOS. Polycystic ovarian syndrome, PCOS, has an inclination towards diseases like excessive weight gain, obesity, and even heart conditions and diabetes. PCOD does not specifically lead to such serious ailments, but the symptoms are pretty similar, like hair thinning, gaining weight, temporary infertility issues, acne, and maybe a little bit of facial hair growth, maybe not as much as PCOS. PCOD is triggered due to sedentary lifestyle, poor eating habits. It's an hormonal imbalance that causes an ovarian disorder. It can definitely be treated much faster than PCOS. And again, like I said, most women probably suffer PCOS and PCOD and are completely unaware because they haven't got it diagnosed. You definitely must check with an Ayurvedic doctor at least once a year to check your dosha imbalances, because you can detect imbalances in your body much ahead of time before it snowballs into a real disease. And this is where preventive healthcare like Ayurveda plays a very important role. Don't wait to get sick. Start investing in your health on a daily basis. And this is something that I say quite often. I'm not a big fan of insurance. I'm sure the insurance companies would not like me saying this, but I'm not a big fan of insurance because you're investing money in an insurance scheme and psychosomatically you're trained to get sick so that you can use that money 20 years from now to get yourself a hospital bed and attach your body to a ventilator. I don't understand that. Like, you are trained to get sick in your mind. I'd rather invest some part of that money in eating organic food, having a healthy lifestyle, investing in good workouts, because the three pillars of good health is fitness, nutrition, and good sleep. And I would rather live a more healthy and a more powerful now than wait to get sick.
Apart from taking care of the root cause of PCOS, PCOD, how can we maintain or regulate the hormonal acne or facial hair?
I know it's a bit difficult to live with hormonal acne and facial hair. It's frustrating, right, for most women because it affects their self-confidence and self-esteem. There are certain things that you can do in Ayurveda. We actually have an oil called Lomasatna Tailam, which helps in removing excessive hair growth from sensitive areas like your face or your skin or the rest of your body. You can definitely invest in that if you like. You can also do an uptan at home. This is one of my favorite recipes. You take equal proportions of the chickpea flour, which is besan, add turmeric, some drops of lemon juice, and you can also add a little bit of yogurt. Mix it well, make a thick paste, apply it on the areas where you have discoloration, which happens with PCOD, or facial hair growth, which happens with PCOS. Apply it, let it dry, and then scrub it off when it's completely dry. That helps in removing a whole layer of dead skin cells and unwanted hair growth. You can also use a soft pumice stone to rub your body. That also helps in removing excess hair growth. Coming to acne, adult acne is difficult to treat usually. I would recommend having bitter foods in your diet like spinach, celery, cilantro, curry leaves, moringa, pomegranate. bitter gourd, which is also called karela, and having foods like neem ka patta is excellent. This helps in purifying blood and thus helps in removing 80% of the impurities that comes under your skin. You can also invest in a good skincare routine. You must ensure to cleanse your skin every single night because there's a lot of oil that has been released that could cause whiteheads or blackheads. You can actually take baking soda mixed with equal proportions of water, apply it on the blackheads, leave it on, let it dry, and then wipe it off. Your blackheads will disappear. That's one. Number two is doing an oil massage for your face actually helps in controlling the oil level in your skin because only oil can cleanse oil.
Wow, okay, that is something new to me.
Yeah, a lot of people who have oily skin or acne or pimples refrain from doing an oil massage for their skin because they think it's going to aggravate the condition. But like I said, only oil can cleanse grease. And oil helps in removing excess oil from your pores and balancing the pH level of your skin. But of course, you have to cleanse your face before you go to bed. Use a good moisturizing cream. Use astringent products like rose water to close your pores. Use ghee every now and then to reduce inflammation of the skin. And if you have pimples, you can take 1 drop of tea tree oil, 1 drop of neem oil, apply it on the pimples directly and let it subside without scarring. You can also use aloe vera gel on your face. That's an excellent way of reducing adult acne and pimples. And most importantly, refrain from using products that are loaded with chemicals. You don't need that for your skin because remember, your skin is the largest organ of the body, which is continuously breathing and drinking and absorbing everything that you apply on it. So use a lot of homemade products for your skin, for your hair, and you can be rest assured that PCOS and PCOD at least will not reflect on your face.
Another common sign is hair thinning. How do we deal with that?
Hair thinning is a big issue for women who face gynecological health issues because it directly gets impacted. You must focus on using good hair products at home. You can start using onion juice as a hair mask. You can also use yogurt with fenugreek mixed in it. That's a great way of stimulating new hair growth and clearing the scalp of any kind of fungal infection, dandruff and such. These are products that really help. You can also use moringa hair oil and include more curry leaves in your diet because that's loaded with iron. That gives you dark, lush, beautiful hair till the very last days.
Well, thank you so much, Dimple, for sharing all this wisdom of Ayurveda because these lifestyle disorders, infertility, PCOS, PCOD are so common nowadays and it's high time for us to get back to our nature and get our lifestyle corrected. Thank you so much for being on the Ayurveda Diaries. One last tip for the audience.
Well, this is a message to all the young girls who are watching this episode and all the young boys as well. Don't let anyone define your value and your worth. You're not your body, you're not your mind, you're not your emotion. You're far more valuable than that. So don't let social media or peer pressure tell you how you must live, how you must look, or how you must feel about yourself. You have the right to feel good, love yourself, and feel unconditional happiness always.